we'll be talking about that and so many other basic issues, Lagos. Okay. Now, like I told you, I will introduce my analyst today. I mean, the doctor who's always with us today. I mean, on Thursdays. Okay. Don't also forget that I will be taking your. I'll be reading. No, I won't be taking calls. All right. I'm not used to taking calls every Thursday morning. All right. From 10:30 up until 12. I am not used to taking calls. So what I will do instead is to read out all of your messages back to back. Okay, I'll read out your message. So, like I often say, in case you have a message for me to read out to everyone or the doctor, feel very free to send in those messages. Okay, feel so free to send in your messages. Yeah, I'll give out the WhatsApp number quickly. I'll give out the WhatsApp number very quickly. You can go there and drop your message, or you can also drop the message for me via YouTube. Yeah, the number is a WhatsApp number. All right, and that's VOP official WhatsApp number. Just send in the message. The number is 081 717 56338. I'll take that again for you. 081 717 56338. You got it right? Thank you so much. Especially for those who, some of these messages I couldn't read out 2 weeks ago. Yeah, because we were not here last week. Okay, so 2 weeks ago, all of those messages we couldn't read out. Today, I will try as much as possible to read them out. If we have the time, so I would encourage you to send in your messages as soon as you can. All right. But then, what are we looking at today? Yes, of course, I bet you want to know what we're looking at today, right? Yeah, you want to know what we're looking at today. Okay, we want to look at obesity and, of course, junk food. Now you understand why I mentioned Lagosians, right? Not other states, but especially if you're in Lagos, Nigeria, you would understand that, hey, the way and manner at which people consume junk food every day is alarming. And for me, I don't know. I know it's got health implications, rather. Of course, yes, I know it has health implications, but then it's not for me to say. The doctor will touch on that for us, and then I'll read your messages alongside, and we're good to go. Like I said, we're looking at obesity and junk food. Dr. Charles Adeogun is just right here in the studio, and we get talking. Dr. Charles, how you doing?
Good. Good morning. How are you today?
Good morning to you. Yeah, I'm good. Doing great. Thank you so much for coming. Now, obesity and junk food. First of all, I want to ask you, any connection?
Yes, obesity is.
You can adjust your microphone up. Yeah, so you can. Okay.
Okay. So obesity is a condition that we find very rampant globally now. It's something that used to be more pronounced in the Western world because of the westernized diets and because of the high sugar content of what people consume. But we're beginning to see that trend also in our climb here. So obesity is, in simple terms, is basically being overweight. So the assessment of being overweight is something based on what we refer to as the body mass index, which is the ratio of your weight to your height. So that means for a given height, you're expected to have a range of weight. Yes, that is safe for you because of your height. So if you're a shorter person, you adding a lot of weight will make your BMI go up. And we know that has been associated with a lot of health implications, like you rightly said. So the contributing factors to that include high sugar diets, eating high calories, and less exercise. A lot of people are sedentary either because they are working remotely or because they are executives. They have a lot of people to send on errands. Then also we have a lot of people that also do chronic alcohol consumption. All those, can relate to obesity. And of course, there is the genetic basis to it. Some people, it just runs in
Okay.
their family where they are all on the big side. But that doesn't mean because you are genetically predisposed to something that you must always follow that trend. You can also make healthy lifestyle choices that can reduce your risk of potential hazards that can affect your health, from obesity. And we know that obesity, we've said it before on the program, that it is linked to high blood pressure, is linked to diabetes, is linked to high cholesterol, is linked to what we call obstructive sleep apnea. Because of your fats around your airway, you can notice that you're snoring, or you have noisy breathing, or you are even breathless while seated. You're not doing anything. And while you're talking, everybody can see that it feels that you're breathless when you talk, or you are easily exerted. Any small activity gets you very, very excited because you are overworking your heart and cardiovascular system. And people who are also obese, the scary part is that they're also at risk of some cancers. We've mentioned that
Okay.
before as
Okay.
well. So we know that being overweight is not in our interest. But it's of concern that we're beginning to see it in our young children too. The younger folks are beginning to be obese. You see a school child who is looking like an adult already, and everybody sees it as, that child is well nourished, that child is, the parents are
It's a big
taking good,
boy.
yeah, the child is from the affluent home. But that is not always the case. Affluence doesn't mean that we should not pay attention to our health. In fact, overall wealth means that you're not just having money in the bank, you're also prosperous in your health and
Okay.
your well-being as well. So it's something that we need to address because we are beginning to see a lot of people who are overweight, and they start having problems with their knee joints because those are the weight-bearing parts of their body. They still deal with arthritis and low back pain and truncal obesity. You see the tummy so big, so massive, and aside the fact that after a while it doesn't even look too good on you because no particular outfit fits you as it should because of your shape. This is not to body shame anybody, but it's just that we're not just after your physical appearance, but the consequences, the health implications on your health is what matters, because you don't want to be dealing with multiple conditions: blood pressure, diabetes, high cholesterol, cancer, all in one person, arthritis, obstructive sleep apnea. It's a lot. It's a lot. Not to talk of the psychological effects it even has on people, because some people, they think they've tried so much to lose weight, but it's not just regulating properly the way they expect it to, and it can affect them psychologically. So it's something that we should pay close attention to, and we should take healthy lifestyle, decisions, exercising regularly, making sure we are eating right, making sure that we don't just pound up calories unnecessarily, cut down on alcohol, and make sure that everything you give your children is only what is healthy, and not just because they are craving it or they are asking for it. We should eat intentionally. We keep talking about that
Of
all the
course,
time.
of course, of course. Now, yeah. Aside that is what's it called now? The problem with junk food, and now you've been able to help us understand, the closeness. All right. We have the junk food here, and then we have obesity here. Now, aside the obesity, junk food is one big deal we should preach. I don't know. We should let Lagosians understand the reason why you should always eat junk food, or the reason why you shouldn't, go near, junk food. Especially in Lagos, people consume junk food a whole lot because there are shops everywhere. You could just stop by and say, please give me a bottle of this, or let me have this. I don't want to give anybody free adverts right now. But then the essence or the reason why we should stop junk food, is it good for us, or is it bad for us?
Junk, as the name implies, doesn't sound good in the first instance. So it's definitely unhealthy food. Most times people opt for fast foods and things that they can easily access, because we live in a city that never sleeps. We live in a city that everybody's on the move. So because of the hustling and bustling, everybody just tries to get what is available to them. And each time they try to get that, they don't keep in mind, what whatever they are buying is going to do to their body or going to do to their system. They are all in the process of, I just need to fill in my belly, and let me just make sure that something is in there before I start my day.
Okay.
So a lot of people settle for pastries, they settle for high sugar diet, they settle for high calorie diets, they settle for all sorts of sugary things because of course they know that when you take a lot of sugar, you have some kind of energy rush that comes to you. So most people enjoy that energy rush, but not realizing that it's only a temporary high. After a while, it crashes, and then you now find out that you're having lethargy, you're feeling weak, and then your body is craving more sugar again because your body has now adapted to the fact that it is when you have that high sugar level that you are working at your optimum or you are filled with energy. But ultimately, we're not doing our bodies much good because when you do this, you just have a spike of insulin, and when your body perpetually gets a spike of insulin all the time, that is not healthy for you. You want your pancreas to serve you for long, and you want your pancreas to keep secreting insulin. But why are you stimulating high levels of insulin secretion on a daily basis like that? That's why you have different classes of food. We should not just be fixated on junk food just because it's easily accessible or it tastes good or it's something that we can eat on the move. We should eat intentionally. We normally say that anything you have to eat, you have to make a mental assessment of the contents or components of the food and make sure that it contains all the right nutrients in their right proportions, because that's the only way you can be healthy. You are what you eat. So if you settle for what is easily accessible at the expense of the value, the nutritional value, then your health will pay for it at some point.
Let's look at junk food. Which set of food would you consider as junk food?
All those foods that you just buy and just because it's just accessible. Pastries, processed foods, sugary foods, all those things that you snack on that you think they are not real food in the real sense of it. There are things that people just pick along that most people call maybe snacks or fast foods. All those things are things that you just get them, you eat them, just load your bellies with it without knowing what nutritional value it's going to give you. Yes, it will fill your belly. Yes, it will give you the sugar rush. You feel good that you have the energy to take on your day, but it's going to just make you pound up calories that you don't need, especially when you are somebody that is sedentary. Maybe your work gets you seated at your desk for long hours, prolonged hours. So it's not going to be helpful in the long run because you just find out that your input is more than your output. So you keep loading up yourself without expending, and at the end of the day, it overwhelms your body.
I also wanted to ask you, which organ of the body, right? Or is there a particular organ of the body that is affected by junk food? Is there a particular organ of the body?
Well, your pancreas that secretes insulin that helps to control your blood sugar, will get the highest blow because it's always having to secrete insulin to help to balance the high sugar content. But it can only do that for just a short period of time before it starts malfunctioning. Because if you already have a risk factor for diabetes in your family and you are playing with junk foods and you don't exercise, because for instance, exercise helps your body to get sensitized to insulin. So you improve insulin sensitivity by exercising. So you are sedentary and you're eating junk foods, you're not exercising, you have a family history of diabetes, and possibly you take alcohol too liberally. You are just a diabetic patient waiting to happen.
Wow.
Yeah, so that's just it. And this also applies to even the young people. So like we said, most diseases now, they are not age restricted anymore. Virtually any age bracket can have any kind of disease now. We even find some young people in their 20s, even teenagers who are living with cancer. You have childhood cancers, you have juvenile diabetes, young children who are already on insulin and all that. So nobody is really exempted from the consequences of not choosing healthy foods to eat and healthy lifestyle. So this applies to everybody, not any particular age bracket. So you have to really, really, really be intentional. You don't eat just because that is what is accessible or available to you. You eat from a place of intention, knowing exactly what you're eating and what it is going to do for your body. So of course, your insulin takes a blow, and then after a while, your heart starts taking a blow because your blood pressure will start going up when you are now obese because you are not exercising. And then of course if you now have high cholesterol with it, because sometimes these foods also contain unhealthy fats that can clog our arteries, increase our risk of stroke, of heart attacks, cardiovascular events and all that. And of course being sedentary also puts you at risk of forming blood clots because we were designed to move around, have a healthy circulation. But when there's stasis, you're not moving around or you're immobile, you form blood clots, which are also potentially dangerous and fatal.
Let me even ask you, how long does these junk food stay in the body?
Well, it's just like your normal regular foods. Most
Some will tell you it
digestion
doesn't digest so
Mo-
because some will tell you it digests very quickly.
most digestion process, takes about 4 hours or less in some cases. But on the average, most foods, you've gotten everything you need to get from the food, between 3 to 4 hours. But the truth is, for the ones that are high glycemic indices foods, those ones are the ones that spike your sugar the most. They just give you that sugar rush. You eat it and it breaks down into sugar. Your sugar gets to a peak. And then that's where everybody is happy that they have energy. They can do 1,000 things at the same time. But after a while, it plateaus and crashes down. And once it crashes down, you now start feeling tired. Your body is now craving for that sugar again. That's why a lot of people have sugar cravings. That's why you see somebody, the person is saying, please, I need something sweet. I need something sweet. Your body is always calling for the cakes, for the donuts, and all the pastries. And you can't seem to have enough of them. And if care is not taken, if you now don't institute discipline in your lifestyle, then everything your body craves for, you just, give in, and at the end of the day you find out that you've taken too much of these things and they're potentially not healthy for you.
I'm trying to ask the normal basic questions about these junk food things so everyone can be carried along. Doc, which food would you consider as a number one unhealthy food?
Number one unhealthy food, it will be the refined sugars. It will be the sugars. Anything that spikes your sugar, be it a beverage, be it a drink, be it fizzy drink or whatever it is that spikes your sugar, that gives you a rush of sugar. It's not in your interest, because sugar can be pro-inflammatory too, because a lot of people, I'm sure you've heard people that say they have a sweet tooth. Anything sweet goes. Anything sweet, once it's not sweet, it's not for you. So there are some people that are already wired that way. So you have to consciously tell yourself, sugar is not completely healthy for you to be consuming in such large amounts on a daily basis, because some people are so addicted to some of these fizzy drinks and those beverages, such that if they don't take about 3 or 4 in a day, they are not okay. The day they intentionally try to avoid it, they feel unwell. They feel like they are lethargic, no energy to do anything, because they've accustomed themselves to it.
You're talking about sugar, and I know that little children love sugary stuff.
Of course.
So what would you put that? Like, you can't pet a child without giving that child what is sugary.
Yeah, well, even if
by extension, does sugar affect a child's brain?
Well, sugar can be. It depends on.
Or a person's brain, whether children or adults.
It depends on the amount and the frequency of use, just like even your medication. So it depends on the exposure, the level of exposure you have to it. How much of it do you take each time, and what is the frequency of consumption? That is what actually causes the problem. So for children that take a lot of sugary drink, well, I won't say children take a lot. Children are dependent on the decisions of the adults in their lives. So I won't blame a child, really. I won't really blame a child for anything. A child is just like clay or plasticine, permits me to use the analogy. You mold the child into what you want the child to be. And a child is not born in a particular way, either to the right or to the left. It depends on the influence that the child has been exposed to. So if you train your child from childhood to eat healthy, to take fruits, to like water, to take real food, and maybe you treat them occasionally to some of these sweet things, well, that will be fine. But if you now make your child have all the things that we know children that we can't mention.
So sweet.
You
cry, you go buy
everything in the fridge is all sugary,
cake.
And then you try to attract them. Maybe when they do well,
ice cream.
When they do well, you want to say you appreciate them. It is something sugary. When they are crying too much, it is something sugary. When you want to distract them, it is something sugary. You are not really helping the children. You really have to let a child, especially in their formative years, to actually get used to the right nutrition, because the children won't be with you forever. It is whatever they remember that you have exposed them to that will live with them and stay with them. So it's very essential that in grooming children, you have to let them know the essence of real food and what nourishing food is all about, and let that be what is always predominant in their diet.
Someone was telling me, just want to stretch it a little. When you see some children, they have this stained tooth, maybe 3, 4, thereabout, up and down, stained. People used to say it's caused by sugar, maybe too much sugar, whatever. The tooth came out well, beautiful, and all of that. All of a sudden, you just find some stains in it, like kind of. They tell you now sugar they cause. I know they chop sugar at this girl at this point. Is it true?
Yeah, but there are many things that can cause dental discoloration. For some people, it could be, some people are even born with it. There are some medications a woman can take in pregnancy that can cause, like tetracycline. Tetracycline has been linked to, giving, teeth stains.
So you're saying a pregnant woman should avoid tetracycline?
Absolutely.
Completely?
A pregnant woman should not even use any drug a doctor has not prescribed in the first instance, because we've said it before that some of the drugs that are safe for you to take, when you were not pregnant, in your non-pregnant state, may not be applicable when you are pregnant, because now a child is involved and there is
Okay.
a placenta that, allows things to cross from maternal circulation into the child's circulation. Everything you take, goes a long way in influencing what happens to your child. So it's very important that a pregnant woman should never self-medicate. That's the essence of the antenatal care. That's the essence of having your obstetrician, who you go to visit at intervals. You have your regular clinic appointments that you must always meet up with, so that you can share your concerns with the doctor. And if you have any concerns, the doctor is the best person to know what is safe for you to use. Even in the breast milk, medications that a woman takes may be secreted in the breast milk. So everything a pregnant or lactating mother takes, a doctor must supervise or oversee it. So for the stainings, yes, tetracycline can cause staining. Some people are born with that. And some people, because of what they eat, even when you take too much coffee, it can also discolor your teeth. Black coffee can also discolor your teeth. And then you can also have a lot of people who eat a lot of sugary things and they don't rinse their mouth or brush their teeth after.
Okay.
You're meant to brush your teeth, twice a day, and let children also imbibe that culture. And anytime you take anything sugary, or even after you eat, you should always rinse your mouth, because if you don't rinse your mouth, you have particles of food, debris of food that gets stuck to your teeth, and they get broken down and they can give you dental caries. Dental caries is a big deal when it comes to the dentist, in causing cavities, dental problems, and holes in the teeth and all that. And all these things, ultimately, it doesn't make your dentition look good at the end of the day. So you find young people who you expect to still have good dentition, they've had that many extractions, they've had holes here and there and all that. And it is really, really not a thing of affluence that you're always saying, I go to, it's good for you to go to the dentist, but it's not that you should not be going that frequently, like almost every month. We advise that you do your scaling and polishing maybe every 6 months and all that. But by the time you're beginning to have you're having extraction, only you, they are feeling your tooth all the time, you're having gum infection, you're having this and all that, you should now consider your diet, what you eat and what you give your children to eat. There are some children that they are so young, they are under 10, but the dental issues they have is alarming. And it's only one indicator: nutrition, diet. What are they eating? What are they allowed to eat? Because when it comes to children, we should always not blame the children, because the children just follow the path you show them. They are under your care and they are subject to your decisions. So if you make the right decisions, it's going to reflect in their well-being. And if you do the otherwise, it's going to be the same thing. And because sugar is pro-inflammatory, it has a number of effects it can have. A lot of people just assume that sugar is just about you taking something sweet in your mouth. Apart from raising your blood sugar, it is pro-inflammatory. And it can cause other debilitating issues that you don't expect. So for everybody, eat sugar in moderation, the refined sugars in moderation, especially for children. But for children, a lot of children seem to get away with it because they are very active, they run around and all that. But please, you never just know. They still carry your genetics. If there's diabetes in your family, please, as much as you can. Even if there's no diabetes in your family, it is still not healthy for them to be taking it in excessive amounts. So everything should be in moderation.
What happens after 3 days of no sugar?
Well, Well, I would just use the analogy of you fasting. It's just like you fasting, because when we say sugar, let's not always refer to sugar, because a lot of people may be thinking are referring to that white cube that you put in your tea. But
Okay.
most carbohydrate foods you eat are broken down to sugars in your body. So that's how your body metabolizes the sugars, the carbohydrate food. So, for instance, maybe we should rephrase the question to say, what happens when you don't eat for 3 days, or when you are in starvation mode? Your body would have a compensatory process where it makes sugar for itself, because your brain requires sugar. Your brain requires glucose to function. Your muscles require glucose, and a lot of your body processes too requires glucose. Glucose is like a fuel. It's like a fuel for your body, and your cells need it,
Okay.
to create energy, ATP, and all that. But the truth of the matter is that when you don't eat, after a while, your body senses the low blood sugar levels, and ultimately, makes sugar from other parts of your body, or from other components in your body, like the fats, the proteins, is converted to sugar, and that's what happens. So you find out that there's a breakdown of fats, there's a breakdown of proteins, in a process called gluconeogenesis, making glucose from new substances, other than from normal carbohydrate, because you are not supplying your body with the carbohydrates or the sugars it needs. So you find out that you have breakdown of fats in your body, and then you may have ketone bodies forming in the process, and then of course your body would never ever just say because you are not eating, it just dies like that. The way God made the body is a full functional combination of different systems,
Okay.
that complement each other. So if one part is faulty, another part will try to fit in for it, and will try to balance things out to compensate for that deficit, until that compensatory mechanism can no longer sustain the functionality of the body. Then problem arises. But
Okay.
for 3 days, your compensatory mechanisms will switch into action. Rather than insulin that takes sugar from your blood into your cells, now glucagon, which is another hormone, will be released to help raise your blood sugar and make sugar from other components in your body.
All right. Quick question now before I start reading the messages. Can one reverse 20 years of bad eating, or 20 years of junk eating? I don't know how to put it. Reverse it. Can you reverse it? Possible?
The truth is that there is no addiction or any behavior that cannot be reversed. It may not be reversed in a day, but surely you can start making progress. Tiny steps, one step at a time. You can actually be on the path to recovery or reversal, because nobody was actually born with any addiction. You were born, without any addiction. All these things are learned behaviors. People that are, I don't want to use the word glutton in nature, who eat a lot, and they are never filled up, it's like they are insatiable, their appetite is insatiable. It was a learned behavior for most of them.
Okay.
All right. So it's something that they can do away with also. They may need professional help sometime. They may need the help of a psychologist. In some cases, they may need the help of a psychiatrist, because people have eating disorders. That's another topic. There's a broad
course.
topic called eating disorders.
Yeah.
People can eat so much, people can binge on food, and people can be anorexic, where they even run away from food just because they want to remain slim, and it looks like they don't it looks like they're in starvation mode. They run away from food by all means possible. That is a kind of eating disorder. So sometimes they need professional guidance or help, and sometimes you may even need the help of a nutritionist or dietitian to guide you. But first and foremost, it comes from a place of commitment and discipline on the part of the person that wants that reversal. The person must be committed to that change, must understand that change is required, must know the consequences of not embarking on the needed lifestyle and dietary changes, and work towards it, be committed to it, and stay consistent with that change. It's possible. It may be difficult, but it's achievable.
Okay. Let's get to take questions from our listeners at this time. Good morning. My name is Kunle Mayo, and I used to feel pain all over my body, especially I can't bend down easily, and my shoulders and my neck used to be stiff. What is the problem? Hope it's not leading to stroke. Or what can I take, because it has been like this for the past 6 months?
Well, we need to ask you some important questions. You need to visit the hospital, and a doctor will ask all the relevant questions. Are you sleeping enough? Because if you are not resting well, your muscles may be constantly spasmodic, having spasms, contracting and relaxing, frequently, and that brings pain. Then also we ask about your posture. What kind of job do you do? Do you do a lot of lifting, prolonged sitting, prolonged standing? Your posture and your level of activities during the day, and where you walk to,
Okay.
can influence some of these symptoms. You may be asked to do some relevant investigations, possibly some imaging, to check, if you have, I don't know, your age too, to start with. Those are also important factors to consider. And then the imagings will let us know if you're having some spondylosis, or it's just muscle spasms, or is it arthritis, or is it rheumatoid arthritis. Especially when you have multiple joints that are aching you, you may need to see the orthopedic doctor or a rheumatologist for proper assessment.
Okay. Mary from Ogun State is saying, what are the symptoms to show that you have blood pressure, low blood pressure? And what would you do to avoid it?
Well, people that have low blood pressure may just simply feel faint, lightheaded, dizzy. They feel fatigued. Is easily exerted. Most time it comes with dizziness and all that. But the only way to know whether it's actually low blood pressure is if you check. You have to have your blood pressure readings checked. You need to get a monitor and monitor the trend of your blood pressure. So we say blood pressure should not be lower than 90/60. That should be the normal minimum it should be. So if you're having anything less than that with these symptoms I've mentioned, and possibly if you're a lady and you're having heavy menstrual flow, or you bleed heavily, then that can be a potential thing to look at. Then also, if you've been stooling heavily or vomiting, losing fluids, dehydrated, you may also have low blood pressure rather. But if you have low blood pressure consistently and you're feeling faint and lightheaded, you should please go to your doctor, and your doctor would possibly find out what the cause is and institute the right management for you.
Okay. A 57-year-old woman is asking, he said, I was tested positive for malaria and typhoid and a PVC of 30%. What is the normal PVC? I keep having these three: typhoid, malaria, and of course that.
But the
As I
truth
said.
is, if you say typhoid, I think typhoid sometimes is overdiagnosed. Sometimes it depends on what test they did for you. Was it the Vidal test they did, or they did a stool culture, or they did a stool salmonella antigen? We need to know which, because we've just had people take antibiotics, for so long without, having a proper basis. Because that Vidal test is not really a reliable test for typhoid, and I know that is what most labs in Lagos do for people. For malaria, if you have malaria all the time, malaria parasite, depending on the level of parasites, can actually destroy your red cells, and you can have a degree of anemia. And being a woman, if you're still seeing your menstrual period, you probably have a little some mild iron deficiency anemia, which is common because of your monthly flow and all that, depending on how heavy your flow is. Then it's also possible to have an assessment of your nutrition, your nutritional status. Do you take a lot of vegetables, green vegetables? Do you take fruits? All those can also help you to keep optimal iron levels, which are necessary for blood production. But ultimately, how to prevent malaria and typhoid is what you need. So for malaria, if mosquitoes don't bite you, you can't. That is the only portal of entry for the malaria parasite. So you make sure that stagnant water around your house is eradicated. You may be sleeping under insecticide-treated nets. You fumigate your household, and then you make sure that you stay away from mosquitoes as much as you can. You can use insect repellent creams or wear protective coverings, clothing that can stop mosquitoes from coming near you. But for the typhoid part, I advise that once you treat typhoid and you treat it effectively and you repeat a test and it is gone, you can have your typhoid vaccine that protects you for 3 years. I think that is advisable, so that at least you stay away
Protected
from
for
it.
3 years.
Yes, it gives you protection for 3 years, and it's very essential that you should know how typhoid
Is
is
it
spread.
expensive?
It's available. It's not.
Okay.
I don't think anything is expensive. I don't use the word expensive when it comes to health, because people buy phones of how much People buy cars of how much? So what is expensive about your health that you
Okay.
shouldn't be able to manage? Then I think also you can also watch out where you eat, your source of food and water, because it's from contaminated food and water you get typhoid infection. So you limit your eating out, especially when you can't vouch for the quality of water or where it was, you know, produced or cooked or prepared. All those are very important. And then food handlers test. If you have domestic workers, you always, before you employ them, make sure you run a food handlers test for them. And most restaurants should do that, because that can help us check the foodborne infections and
Oh, yeah.
limit the spread in the community.
All right. Soloflex from Abule Ado is saying, I want to know if gallstone is, or if, what are you trying to say? Okay. I want to know if gallstone in the gallbladder can be remedied with drugs and enough water intake.
Okay, that's a good question. Gallbladder is just where your bile is stored, is just very close to your liver. And a lot of people have gallstones at some points, and it's formed from cholesterol crystals. It could be a very painful experience, causing inflammation of the gallbladder in some instances. So basically, what you need to do when you have gallstones is okay, first and foremost, how did you diagnose the gallstones? I'm sure you must have gone for an abdominal ultrasound or an imaging, and they saw
Okay.
stones in your gallbladder and all that. The first thing to do is you need to see a general surgeon. The general surgeon assesses the level of gallstones you have and the level of pain you have. He may think it's a surgical procedure, so that is not a decision for you to take. You need to see a general surgeon who would examine you, and based on the findings from the scan and his own clinical findings, while examining you, will determine whether you need a surgical intervention or not. In some instances, you may be given some cholesterol medications, and in some instances, there are some medications that we also give that may help, with the gallstones.
Okay.
And then, of course, with painkillers and all that. But ultimately, if you do need surgical intervention, I know a lot of people still run away from surgeries. If your doctor, your surgeon tells you it's a surgery that is required, please just comply.
All right. Is it good for kids from 2 years to 5, to 6, to be taking tea, indomie, egg every day? I understand where this person is going from. Every day when you go into school, some kids must take indomie. They must give them tea, egg must be there. All of these every day is, I think, one of the reasons why this person is asking.
I think you should not be fixated on any kind of food, any particular kind of food. Yes, egg is relevant because they are growing children. They need a lot of proteins and all that. But in as much as, it doesn't have to be the noodles all the time. You should have a proper meal plan written out. There are very, very rich sources of protein, other rich sources of vitamins, and good sources of carbohydrates that they can eat that are nourishing to the children. You don't have to be fixated on only indomie, for instance. There are other good foods that they can eat. But eggs, yes, it's important. A healthy amount of milk is also important for them, and then you also make sure that vegetables and fruits are a crucial part of their diet. So it's necessary that if you're at a loss at what to eat, you can talk to a nutritionist. You can even speak with your pediatrician to give you advice on what is appropriate for that age bracket. Because children, they have preferences for food sometimes. What you think is nutritious or what is nutritious for them, they may just decline and say they don't like it, and they cry each time you serve them. But you should have alternatives that can also meet up their nutritional requirements.
My question is, how can I stop blood clots?
Blood clots? Well, I'm always very wary of people that give themselves diagnosis, because how do you know you have blood clots in the first instance unless your doctor has told you? So please, I want to believe this diagnosis is not what you have made by yourself. If your doctor has actually told you that you had blood clots, I believe that some investigations would have been done prior to that diagnosis. So if you do have blood clots, that means that, number one, you may need to be on some anticoagulants, which I cannot mention here. Your doctor will have to be the person to recommend the anticoagulants for you. If you have blood clots, it depends on where. Do you have deep vein thrombosis in your calf? If you're having swollen calf, the calf is warm to touch, you feel some redness there, then you may need to make sure that you're wearing your compression stockings, you're on the right anticoagulants, and you're going for frequent checks. There are some tests that we do, the PTINR, that helps us to know their coagulation studies. It helps you to know how thin your blood is and how thick it is. So that informs the doctor on how the anticoagulation should be. Because if you have blood clots, it can be potentially fatal if that diagnosis is correct. Because if the blood clot dislodges from where it is and enters the pulmonary circulation, you have pulmonary embolism that is fatal in most cases, because it just blocks circulation to your lungs, and the person becomes breathless, may cough out blood and die instantly. So this is a serious thing if you do have blood clots, because you need to always see your doctor, see your cardiovascular or your vascular surgeon, as the case may be, to make a proper assessment. I hope it's a correct diagnosis, because if it is, you need proper monitoring.
Well, the same person is asking, what about a child that doesn't eat food after having stopped breastfeeding, except taking juice?
Well, yes, there are some children like that. It's quite difficult.
When they stop breastfeeding,
yes, you don't even know what food to start them with. But that's why it's advised that you do exclusive breastfeeding for the first 6 months of life, and you don't even give water. You just give only breast milk, because it contains everything the child needs. But after 6 months, we always advise that you should start complementary feeding for the child. Start introducing certain meals that the child will get used to. And all these things are good for you to start them early. And it's also necessary for you to watch for the preferences of the child. I'm sure at some point, if you try certain foods with the guidance of a doctor or a nutritionist, a pediatrician, for instance, you'll be able to find out at least what the child is able to tolerate better than other things. And when you introduce that, it's better for the child. You can do your fortified pap. You can be pap, that you add some very rich and proteinous things to it that can increase the nutritional value of it. And then you can also introduce some very, very light soft foods that, you can add some veggies, some vegetables, or some blended vegetables to it, crayfish, soya beans, a lot of rich proteinous things. Just try to speak with your pediatrician and also be open to trying a lot of things for the child. You never know what the child will be open to, because the child cannot, be sustained by just juice. After a while, you notice that the juice is not giving the child everything the child needs, and you don't want the child to start having nutritional deficiencies that can happen in a child, because you start noticing that the color of the hair of the child, is not what it should be. The hair is fluffy. The child can start having some skin manifestations, be underweight for age and all that. So you should speak with a pediatrician, and you should speak with a dietitian who would guide you on what is appropriate for the child, and be open to trying new things.
Okay. Thanks to the doctor in the studio for the education. Please, I would like to know the health implications of intermittent fasting in weight management. Also, is there any way to manage or reverse a case of stomach inflammation, that is fat belly, especially in the early stage?
Well, intermittent fasting is something that is healthy, because our digestive system, is not expected to be working 24/7 round the clock. You need to give it a break for it to function optimally. And then you also need give your body time to absorb the food you've eaten and make good use of it. But each time you give your digestive system rest, you're actually doing your body a lot of good. And it has also been shown that intermittent fasting, those periods of fasting, puts your body in a mode that what we call autophagy happens, whereby some of your immune cells will start eating up what is not proper in your system. What is unhealthy. The unhealthy cells are wiped out, and then it helps your body, do a thorough cleansing, or like a detox. So it's quite healthy, and everybody is encouraged to do that. That's why fasting is not just for spiritual purposes. It also has health benefits.
Okay.
So intermittent fasting helps with that. But for weight management, it may go beyond just intermittent fasting. Weight management also entails, the time you are not fasting, portion control. What are you eating? What quantity are you eating? That matters, because your intermittent fasting will be useless if by the time you now decide to eat, you are eating 1 year's food at one time. So you have defeated the purpose. So the portion, and then the calories, you need to know what you're eating, and what amount of calorie are you obtaining from that food. So it means that apart from the portion, you are not eating too many things that can raise your calories. And then your level of activity, your level of exercise is also important. then ultimately you may also find out that a lot of people, apart from what they eat, they do a lot of alcohol. Alcohol too can pound up your calories and give you the belly fat. So the person talking of belly fat, if you're drinking alcohol, you're not really helping yourself in that regard. So you may need to restrict your alcohol consumption. You may, of course, go for exercises, the tummy trimming exercises. And in some instances, there's really little you can do if your obesity is from another condition. Because if you are hypothyroid, for instance, people that live with hypothyroidism gain weight without trying, because it's a hormonal thing that is linked to your metabolism. Your metabolism is so slow that you can't just explain why you're adding weight. So until you tackle that hypothyroidism, your weight loss regimen or your weight loss program will be useless. So you really need to find out what is causing your obesity. Is it from genetics? Is it from your diet? Is it from an underlying illness? Even people that have PCOS, ladies with PCOS, are also overweight. They just find out that they're pounding up the weight without trying. So it's very essential that you nail the cause of your obesity and then you treat it accordingly. If it's an underlying condition, you manage the underlying condition. If you need to see your dietitian or nutritionist, you do the same. If you need to hit the gym, if you need to work out more, that is also available for you. But for some people, despite all, it's still difficult for them to lose the weight. Then you may now look for other interventions where you may use some medical intervention. Some medications are available that help the way your body absorbs fat. They're available. We may not be able to mention them here. Then you have the injections that also help in some cases, which is not applicable to everybody. We should emphasize that. And then ultimately, surgical intervention in some cases may be required to manage the weight.
Okay. So many questions here. Let me see if I can quickly touch on them. If the insulin which is secreted from the pancreas is faulty, what are the remedy we can deploy?
The only remedy is to now administer insulin, because insulin is the problem. In type 1 diabetes, where the pancreas does not produce insulin, stops producing insulin, or produces insufficient insulin, or you have an autoimmune condition that damages the pancreas, or a person is born that way, just like in type 1 diabetes, then the remedy is to replace insulin. So those are the people we place on insulin as treatment, for control of their blood sugar. So it has to be insulin administration.
My question is, if I'm a diabetic patient and I undergo a fast, can it help to curb the sugar, or curb out the sugar in the blood that can't penetrate the cell?
That's a very good question, because the truth is you are diabetic, meaning that your blood sugar is elevated, and you think by not eating, if sugar is coming into your blood by eating, so not eating should reduce that. That's wrong, because I told you there are compensatory mechanisms that still produce sugar even if you are not eating. So your body would look for other ways of making sugar if it senses that you are fasting longer than usual. You're staying away from food longer than usual. So it has to go into that's why we don't die when we don't eat, because your body makes the glucose from other sources. Okay. Breaks down your fat, converts your proteins to sugar. So at the end of the day, you still have the spike of sugar you're running away from. So you get sugar not only from the food you eat, other compensatory mechanisms are there to raise the sugar. So that means that you can't manage diabetes just by running away from food. It is for you to eat the right foods and then use your medications, and your lifestyle changes.
Doctor, please help me. I will be going for surgery next week as a result of cataract caused by a diabetic condition. But my worry is that after the surgery, won't the cataract come back? Because I'm spending up to 1 million naira for the surgery.
Well, cataract is something that comes with aging, and in some cases, people that are diabetic, are at risk of it. Basically, cataract is increased opacity of the lens of the eye. So you're actually having a cloudy vision and you're not seeing properly. And the surgery is the only verified treatment, that we can assure you that is what will restore your vision, where the lens of the eye is going to be replaced. The truth of the matter is your diabetic condition must be properly managed. You must make sure that even prior to your surgery, your sugar levels are controlled, But ultimately, if it is done properly and you maintain a normal blood sugar control, you are probably not going to have any issues to worry about. So it's important that you are focused on your blood sugar control in terms of your diet, in terms of your medications, and doing your sugar check monitoring.
Okay, Monica is connecting with us from Abia State. Yes, sir, please, I do feel some kind of pain in my body. moves around in my body and all of that. Sometimes the pain occurs in my chest, sometimes in my back, at my back. And she's just 27 years. Pain.
Migrating pain moving all around. Sometimes these things may be as little as you're not getting enough sleep, you're not getting enough rest, you have high stress levels. It could be. Then secondly, you can go to your doctor and your doctor runs all the tests and finds nothing, because sometimes we have some conditions that are from somatization, meaning that they are not real pains, that really are present. Something else is underlying that is giving you that sensation of pain. So you have to do a thorough assessment with your doctor. Your doctor will take a good history and examine you closely and run some relevant investigations to be able to see if there are any things that are adding to that pain or contributing to that pain. But if nothing is found, then they may actually place you on certain medications that they relieve you of anxiety and they relax you. So those are important things you need to look at.
Okay. Because of these 1,000 questions we have, I'll just do one. Yeah, seriously. I mean it. There are too many questions here. Okay, this person is saying, his name is Chooks. Good morning, Doc. Please, I want to know what can be responsible for waist pain, especially whenever I drink or eat anything sweet. As I'm talking to you now, I am at home because of the pains since yesterday. I don't go to work. I'm driving keke. It also causes me to feel dizzy in my eyes.
So please have your sugar checked, especially with this last part that you said, causing dizziness. Because sometimes when you have sugar, high sugar levels, when your sugar levels are so high, you're actually very, very weak. You'll be thinking, but you have so much sugar in your blood. Why are you feeling weak? Because the cells that need it are not getting the sugar. So you would actually feel very, very weak and lethargic. You should find out what your sugar status is. Then secondly, for the waist pain, you need to find out. It could be because of your posture, it could be because of the work you do. You need to get it evaluated. You may need some muscle relaxants, some anti-inflammatories, and you need enough rest as well. And in some cases, physiotherapy may be very beneficial to you to eradicate the pain, because everything is not about medications all the time, because our people abuse analgesics a lot. So it's very important that you know that rest is important, hydration is important, your physiotherapy is important, and regular exercise also helps your muscles and your musculoskeletal system, stay healthy.
Emeka Onuamara was diagnosed of low blood sugar. What do you think he should do?
Low blood sugar, I would not have you just take one reading and run along with that. It must be consistently low and giving you some symptoms that are of concern before I can actually now say, okay, this is what you should do. So you can't just say I have low blood sugar, because we've seen people say they have low blood sugar and the only reason they had low blood sugar is when you ask them, when was your last meal, they'll tell you that, hey, I've not eaten since morning. You've not eaten since morning and you expect not to have low blood sugar, and then some of them will be sweating, passing out and all that. But it becomes of concern when you are showing intense signs of hypoglycemia, meaning your blood sugar is low, like you're sweating, you're having tremors, you're having palpitations, your heart is racing fast, or you're feeling faint, or you're disoriented. Then that's, of course, is of significant concern, and then we can say you should go and see the doctor for that. But if you are still functional, going about everything, and you just did only one check one time and you notice your blood sugar is low, you don't label yourself. So please, let us avoid labeling ourselves and giving ourselves diagnosis a doctor has not given us. So it is your doctor's diagnosis to know if that is what you really have, and you cannot just use a reading, just one reading, to confirm that that is how it is all the time.
I've been having weak erection. What kind of test would you recommend for me?
It depends on your age. If you are within the andropause age,
the last one.
if you are within the andropause age, that you are about above 50, you are 55 to 65, you may be experiencing andropause. Your testosterone levels may be low. But if you are not within the andropause range, but generally, if you're having low poor erection, we are concerned about your blood supply and your nervous coordination. So you should check your testosterone levels, go for your sugar check to rule out diabetes, do your lipid profile to be sure you don't have cholesterol blocking circulation, and making sure that we know about all the drugs you are taking, that one drug you are taking is not giving that kind of effect for you, is also very important. And prolactin levels too are very important to check.
Everyone, there are so many questions here, we can't go further. But then on Thursday, okay, but from 10:30, just join me quickly. I'll trash your question, but you have to repeat them, okay? You send them back to me. Thank you so much. Don't forget to reach out him, doctor, and some other doctors that will be waiting. We have Doctor's Mike on Facebook and of course Instagram. Just go there, search for Doctor's Mike, DOCTOR_SMIC is a mic, Doctor's Mike. Just drop a message there, and there are several other doctors waiting. They'll be waiting to answer your questions
on Facebook and Instagram.
Facebook and Instagram. Don't forget. Thank you, Doc. We have to go because of our time.
Thank you.
Thank you, everyone, and have a blessed day. My name is Ikame Jude. Good morning to you.
Who plays the best songs? Check. Hey, come on! We do. Hey. We are Voice of the People, 90.3 FM.
A new harmony for my life. Since I feel like this, oh.